Hello, everyone. My name is Christopher Xenakis, and today is May 19th, 2002. And today I'm going to be presenting my Week 9 presentation. And the syndrome I chose to talk about is the nephrotic syndrome. So nephrotic syndrome is a kidney disorder that causes your body to pass increased amounts of protein in your urine. This is usually due to damage to the glomeruli or the what also known as the small blood vessels in the kidneys that assist in filtering waste and excess water from the blood. The clinical manifestations and or symptoms of the syndrome is almost always severe swelling, severe swelling or edema, particularly around the eyes and ankles and feet as well. Low albumin levels, high cholesterol and lipid levels, fatigue, foamy urine, weight gain because of the fluid retention, and loss of appetite. And the syndrome can affect people of all ages, and it usually leads to more serious complications such as like blood clots, increased susceptibility to infections, kidney failure, as well as hypertension. I'll now continue and compare the syndrome with three others that can occur in the urinary system. One of them is obstructive urinary syndrome, which is described as the urine being unable to leave the body, thereby building up in the kidneys. To be specific, there is a back pressure of urine into the collecting system of the kidneys, which involves local ischemia due to like distension and increased intratubular pressures. It can also be known as obstructive uropathy. And symptoms for this include urinary retention, weak or interrupted stream of urine, blood in the urine, and hip or back or abdominal pain. Another syndrome to differentiate from nephrotic syndrome is urinary infection syndrome, which is pretty much a bacterial infection of the bladder and can also affect its surrounding structures as well. And it's more frequent in women. Now, the bacteria that causes this syndrome will be comprised mainly of enteric coliforms, which usually inhabit the periurethral vaginal introitus and will invade the bladder mucosal wall and cause cystitis. Symptoms usually for this syndrome are pain when urinating, frequent urination, and difficult in starting the urine stream. Ironically, peeing is typically the mainstay of treatment, especially for women after, for example, intercourse, so bacteria can finally leave the system. Another syndrome to differentiate from nephrotic syndrome is chronic renal failure syndrome, which is characterized as a loss of kidney function that lasts for 3 months or more, and it's diagnosed usually with the eGFR level, which is the estimated glomerular filtration rate of less than 60 milliliters per minute per 1.73 square meters. Clinical manifestations for the syndrome include nausea, vomiting, fatigue, oliguria, or also known as low urine output, muscle twitching, swelling, hypertension, chest pain, etc. So it is easy to mix this up with a possible nephrotic syndrome diagnosis. But with chronic renal failure, you would have like a history of long-standing chronic prostatic disease, skin pigmentation, low serum calcium levels, and high phosphorus levels, and a very high blood urea nitrogen level as well, even though they appear healthy and are still passing a normal volume of urine. The mechanism of nephrotic syndrome is usually involved with a multitude of diseases in the urinary system. One of them are systemic lupus erythematosus, or SLE, which is an autoimmune disease that affects a whole host of systems in the body and causes whole body inflammation and tissue damage to many organs, including the kidneys. So once your kidneys are inflamed, it can lead to blood and protein in the urine, which pretty much defines nephrotic syndrome, hypertension, and kidney failure. The part of the kidney that SLE affects the most is the glomerulus, which, as mentioned before, is the network of capillaries that function in the filtering of harmful substances. Another disease related to nephrotic syndrome is amyloidosis, which is a heterogeneous acquired or hereditary disease that happens because of abnormal deposition of beta sheet fibrillary protein in tissue. The most common causes are actually subtypes of the generalized amyloidosis, such as immunoglobulin light chain relate amyloidosis, or ATTR amyloidosis, and reactive amyloidosis, which are mostly due to chronic inflammatory diseases and rheumatoid arthritis, another autoimmune disease. In regards to the kidney, amyloid will build up in the kidney and cause leakage of protein in the urine, and which then leads to a low blood protein level and swelling, which is significant in nephrotic syndrome. Another disease related to nephrotic syndrome that happens to be a major cause is focal segmental glomerulosclerosis, which is where scarring takes place over the glomerulus that initiates podocyte injury and damage, leading to protein loss and development of focal sclerosing lesions as well. The podocytes are the cells that provide structure to the glomerulus and its barrier as well to prevent proteinuria. To differentiate between the children and the adults for these two disorders, the children with this disease almost all the time present with full-blown nephrotic syndrome, while adults will have the same but with hypertension, microscopic hematuria, and or renal insufficiency. So I hope everyone's doing well in the class. That's about it.